Have you ever experienced a sudden tightness in your chest, or found yourself getting winded just walking to the mailbox or climbing stairs? While many of us chalk these up to aging or overexertion, they could be more than just a sign of getting older. In fact, these could be signs of heart disease, a condition that affects millions of people, particularly those over 60. Heart disease is the leading cause of death for people over 60, but the good news is that many heart disease symptoms don't come on suddenly. They often develop gradually over time, offering you the opportunity to act before a serious event, such as a heart attack, strikes. The key is recognizing the early signs and getting help when you need it. In this video, we're going to cover 3 critical warning signs of heart disease that you should never ignore after the age of 60. These warning signs can help save your life, so let's dive in and discuss what you need to look out for when it comes to your heart health. Starting with one of the most common and often overlooked symptoms, chest pain. Number 1, chest pain or discomfort. This is perhaps the most well-known sign of heart disease, but it's often misunderstood or ignored. When people think of heart disease, many picture a sharp, sudden chest pain. However, chest pain from heart disease is often much subtler and can feel more like a pressure, tightness, or fullness in the chest, which many might dismiss as indigestion or anxiety. Here's the critical point. Not all chest pain is created equal. While some people may experience the classic chest pain, others may feel just a mild discomfort that they brush off. However, chest pain that feels like pressure or tightness, especially if it comes on suddenly and doesn't go away quickly, should be treated as a red flag. Let's talk about how to distinguish heart-related chest pain from something more benign. If you experience chest discomfort that lasts more than a few minutes or that radiates to other areas of your body, such as your arms, neck, back, or jaw, you need to seek medical attention right away. It's important to note that chest pain doesn't always mean a heart attack. It can also be a sign of angina, a condition where the heart doesn't get enough blood and oxygen. Angina often presents as tightness or pressure in the chest, and it may occur during physical exertion or emotional stress. If you're unsure whether you're experiencing heart-related chest pain, ask yourself these questions. Is the pain sudden? Pain that comes on unexpectedly and feels different from what you usually experience could be serious. Does the pain last for more than a few minutes? Short, intermittent pain might be from something benign like muscle strain or heartburn, but lasting pain that doesn't ease up is a reason for concern. Is it accompanied by other symptoms like dizziness, nausea, sweating, or shortness of breath? These signs are red flags that indicate the pain could be from your heart. Take the case of Tom, a 70-year-old man who had a feeling of pressure in his chest one afternoon. He assumed it was just heartburn, but the discomfort persisted, and he began sweating. When it radiated down his left arm, he knew he needed to take action. After an urgent visit to the hospital, Tom was diagnosed with angina. If he had waited any longer, he could have been in much greater danger. Remember, chest pain may not always feel like what you see in the movies. It can be mild, subtle, and easy to dismiss. But if it's unusual for you and it doesn't go away, get help. Don't wait. Your heart is too important to ignore symptoms like chest discomfort, even if they don't seem severe at first. Number 2, shortness of breath. It's normal to feel winded after running a few miles or climbing a set of stairs, especially as we age. But if you're experiencing shortness of breath during everyday activities, things like walking around your house, grocery shopping, or even just getting out of bed, it's important to take note. Sudden or unexplained shortness of breath can be a sign of heart disease. When your heart isn't pumping blood effectively, the body starts to struggle with circulating oxygen-rich blood, which can lead to fluid buildup in your lungs. This is a hallmark symptom of heart failure, a condition where the heart becomes weak and unable to pump blood efficiently. Imagine this. You're doing an activity you've done countless times before, like walking around the house, but suddenly you're out of breath. This might feel normal for someone who has been sedentary, but for someone who has been active, it should raise concern. There are 2 main causes of shortness of breath that should concern you. Heart failure. When the heart is not pumping blood effectively, blood backs up into the lungs, causing fluid retention, which leads to difficulty breathing. Coronary artery disease. When the arteries become blocked or narrowed, the heart isn't able to supply the body with enough oxygen, leading to shortness of breath, especially during exertion. Take Helen, a 74-year-old woman who noticed that she was feeling short of breath after just walking to the mailbox. She thought it was just part of aging, but after a few weeks of feeling more winded than usual, she went to see her doctor. It turned out that Helen had heart failure, which was causing the fluid to build up in her lungs and make breathing difficult. Fortunately, with the right treatment, including medication and lifestyle changes, Helen is feeling much better and more energetic. The key is recognizing when your shortness of breath feels out of the ordinary. If it comes on suddenly or if it seems to get worse over time, make sure to check with your healthcare provider. The earlier you catch heart failure or coronary artery disease, the easier it is to treat and manage. Don't dismiss this symptom. Breathing is everything, and your heart's ability to pump blood is central to that. Number 3, swelling in the legs, ankles, or feet. Swelling in the lower extremities can happen for many reasons. Maybe you've been on your feet for too long or it's a hot day, but persistent swelling, especially when it happens regularly or gets worse, could be a serious warning sign of heart disease. Edema or swelling occurs when your heart isn't pumping effectively. As blood flow slows down or backs up, fluid can accumulate in the lower parts of your body, especially the legs, ankles, and feet. This can cause them to feel heavy, puffy, or tight. In addition to causing physical discomfort, this type of swelling can also affect your overall quality of life. Heart failure is one of the primary causes of edema. When the heart is weakened and unable to pump blood effectively, it causes fluid buildup in the body. For many people, the first signs of heart failure are swollen feet and ankles. Let's look at George, a 72-year-old man who started noticing his feet swelling, especially at night. Initially, he thought it was just the heat, but as the swelling became more pronounced, George decided to see his doctor. After a thorough examination, he was diagnosed with heart valve disease, which was causing fluid to pool in his legs. With medication, changes in diet, and regular exercise, George is now managing his condition and feeling more comfortable. Swelling can also be linked to conditions like kidney disease and liver disease, but the heart is often the culprit when fluid builds up in the lower extremities. That's why it's essential to see your doctor if you notice any unexplained swelling that doesn't go away after resting or elevating your legs. Even mild swelling can be a sign of serious heart issues. Early diagnosis and treatment are critical to preventing long-term complications. Additional warning signs: fatigue and dizziness. In addition to the 3 major signs I've just covered, chest pain, shortness of breath, and swelling, there are a couple of other symptoms that can indicate heart disease. Fatigue, feeling more tired than usual, is a common symptom in people with heart problems. This happens when the heart isn't pumping blood efficiently, which leads to a lack of oxygen and energy in the body. Fatigue is often one of the first signs of heart failure. Dizziness or lightheadedness. When your heart is having trouble pumping blood, you may experience dizziness or lightheadedness. This can happen when the brain isn't getting enough oxygenated blood, leading to the sensation of fainting or being off balance. Take Margaret, a 69-year-old woman who was feeling unusually tired for a few months. She brushed it off as just aging and stress. However, when she began feeling lightheaded every time she stood up, she decided to see her doctor. After some tests, Margaret was diagnosed with atrial fibrillation, an irregular heart rhythm that can lead to reduced blood flow to the brain and cause dizziness. She's now on the proper treatment, and her fatigue and dizziness have improved. If you find yourself feeling fatigued without explanation, or if you feel dizzy or lightheaded for no apparent reason, these symptoms could indicate something more serious like an irregular heart rhythm or a weak heart. To recap, here are the 3 critical warning signs of heart disease you should never ignore after 60: chest pain or discomfort. If you experience sudden, persistent chest pain or tightness, or it radiates to your back, neck, or jaw, get medical help immediately. Shortness of breath. Feeling unusually winded, especially from everyday activities, could be a sign that your heart isn't pumping effectively. Swelling in the legs, ankles, or feet. Persistent or worsening swelling could indicate fluid buildup due to heart failure. In addition, keep an eye on fatigue and dizziness. These can often be overlooked but may point to something more serious going on with your heart. If you're experiencing any of these symptoms, don't wait. Take action and speak with your healthcare provider as soon as possible. Early intervention and treatment are the best ways to manage heart disease and prevent long-term damage. Your heart health is the cornerstone of a long, healthy life. So if you've been feeling any of these warning signs, make it a priority to get checked out. You deserve to live a long, active life, and taking care of your heart is the first step toward that. If you found this video helpful, please give it a thumbs up and don't forget to subscribe for more health tips. Share this video with someone who could benefit from this information, and if you have any questions or personal experiences to share, leave a comment below. We'd love to hear from you. Take care of your heart. It's the one you'll have for life. Thanks for watching, and we'll see you in the next video.